Hey everybody, this is Dr. Daniel Choi from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center, and today I have my lovely treatment coordinator, Jackie.
Hi.
She's going to be helping us out today because on this YouTube video that I created, it was basically talking about the cost of like a snap-on denture. We were getting a lot of comments, and they were like basically accusing us of like kind of like beating around the bush and say, hey, like a lot of comments about really how much does it cost, like, and you're saying that it's depending on a lot of variables. And they wanted a solid number, right?
Right.
So, Jackie, what would based off of like obviously you're the one that's presenting all these treatment plans, right? And so, what is the true cost of like a snap-on denture? Like it depends, right?
It really does depend
Yeah.
because some patients they're walking out the door with like a $7,000 per arch treatment plan, and then there's some that's like up to $20,000 per arch.
Right.
So it's such a wide range. It's hard to say.
So if you watched part one of our video, basically you would see that like it depended on the number of extractions, right? Like, do you need additional bone grafting? Because when we're placing your dental implants, we need to get, for a snap-on denture, your implants to be as parallel as possible. And in order to do that, we need to add some more bone in certain areas. You might need sinus lifting. So that's more added expense for the surgeon. How many implants?
Yep.
2 minimum on the bottom, 4 minimum up top. You might need more if your bone is super soft. You might want 4 on the bottom to get extra stability. Some patients complain that
Yeah.
two
They
is
started with 2.
yeah, they started with 2. It stays in, but then there's a little bit of rocking,
Flexibility.
So they then later on want 4. Using the same denture or an old denture, like yeah, absolutely, you can do that and save some money, and then we can put the inserts on the bottom. But then the other issue with that is like, is it as aesthetic? Like there's dentures that are like highly like that have better looking teeth on them that look more natural. That's a more expensive denture. Also, the fit's going to be a heck of a lot better,
Yep.
right? I tell people like, do you want to take an old shoe and spray foam it, or do you want to get a brand new shoe? And that's kind of the same concept with the denture. Sedation, different parts of the country. We've seen patients, right? Like they could be from like an hour away in like Tyler or like certain remote parts of town.
Yep.
There's a specialist out there who's busy, and like it's crazy how much they're charging.
Yeah.
They're paying like their patients are paying an obscene amount of money because there's very few specialists out there in certain areas. One of the risks that you face is that if you go to somebody that says, "Oh yeah, I can do it for you," and they don't have as much experience, then just read the comments on my previous part 1 of this video. You'll see a lot of people complaining about like bad experiences. They paid a lot of money. Now they're kind of like in a bad situation because now they can't, and I'm actually going to show you a few cases of that. Actually, let me show you here real quick. Here's a patient that had a snap-on denture placed probably about 30 minutes north of us here in McKinney, and they didn't bury this implant deep enough, had a big infection on here, the prosthesis, because there was not enough clearance. The denture kept on breaking. He tried fixing it in his garage. He got so frustrated with his dentist. Here's another patient that had mini implants. These implants were failing. This patient ended up in the emergency room twice. The general dentist who did it for him, no offense, didn't look like it had much experience. Patient paid $10,000.
Yep.
Only got 2,000.
Yeah, 2,000 back.
2,000
Yep.
back. Felt real bad for this patient. This patient, early dementia, and couldn't eat, had no money, went to the emergency room twice, and just ended up in a bad situation. So the most they could do with us was just 2 implants on the lower, and we fixed him up. This was a patient that had many implants placed, mini implants again. Couldn't get the denture on, and had to get them all removed. This patient also ended up in the emergency room, unfortunately. And so this patient, the implants weren't placed parallel. Patient was having issues having this placed on. So why I show you cases like that is it does matter who you go to. You want to go to someone that knows what they're doing. You might get somebody else that, I'm not going to name any names, certain practices that can do it for you more affordably, but they'll charge you a cheaper price. Some of these you got to ask these questions, like how often do you do these? Like what is the prosthesis like going to look like? Are you going to make me a new prosthesis after the immediate denture? Also, whether you have insurance, that factors, right?
Yep.
Depending on your insurance, can you talk a little bit about that real quick?
So depending on your insurance, because everyone has an annual max typically, there's some that are unlimited, but the typical insurance has an annual max. So by the time we get to like at least 6 or 7 of the extractions, we're almost maxing you out of your insurance. So people are like, can I use my insurance with this? We are using it, but we can only use but so much.
Right.
So by the time you get into like your first implant or your second implant, you've already maxed out for that treatment plan.
So I have a comment here on part one of this video where they're talking about like, hey, his personal experience was snap-in denture, 15 days. I mean, yeah, 15 days, having 12 teeth extracted. What was his total cost?
His total was 15,000.
15,000.
In
Okay,
Virginia.
yeah. So in Virginia, right? So here's the other thing that we want to talk about. Like we do a lot of all-on-4 at our practice too. We do a lot of snap-ons. We do a lot of all-on-4. We got patients that have combination of snap-on and all-on-4 in the same mouth. Patients will always say they love their all-on-4 way more, right? Our all-on-4 starts at $16,000. If you're paying $15,000, I can't in good conscience tell you to do it like a snap-on, like with the fact that we now have our all-on-4s like starting at 16,000, because patients will say that the whole experience and just tell them about your mom.
Yeah, so my mom actually started out with the snap-on denture because financially it made sense at the time. But she was in her traditional denture that you have to wear for your healing for quite a long time. So she saw the effects of it coming in and out, in and out, in and out, and she didn't think she wanted to do that for a snap-on. So she actually upgraded to an all-on-4 because of that reason.
She loves it.
Yeah, she talks about this all the time.
Yeah. And then your dad ended up doing it.
Yep, and my dad as well. So he actually was against going to any dental offices. So we brought him in here for 3 consults. Took us 3 times to get him to actually do the all-on-4, and he loves it. The first time he had his corn on the cob was like last week in like 30 years. So he's obsessed.
So we just, hopefully that can answer some of the questions. Like we aren't trying to be evasive, right? So we do want to like give you helpful information with these videos, and so we did go over again, like extractions. The number of extractions is going to affect you, like do you need bone grafting? Because you can't just place the implants where the bone is. You need to get them as parallel as possible so that like I can place the implants, but how it's actually going to function, right? It's these implants need to be placed as parallel as possible, right? How many implants? 2 minimum on the bottom, but 4 is better. Like up top, at least 4 implants, maybe 6. Using the same denture or getting a new denture made. That's more cost. Even the quality of the denture. They have different lines of dentures. Also sedation, different areas of the country. Even within like, a few hours of Texas, you're going to see we're in the Dallas-Fort Worth area. You're going to see dramatically different pricing. We have a lot of specialists here, so we had to be more competitive, so we do lower costs. If I'm out in the middle of nowhere and I'm the only specialist, these guys are charging a ton of money.
Yeah,
right?
For snap-ons, not even all-on-4s.
Exactly. So you'll be out in the country, and then our all-on-4s are starting at $16,000. You're gonna have people charging $30,000 for an all-on-4 out in certain parts, like in the country. So also insurance is gonna be pretty much standard, and then also the quality of your surgeon. Do they do this a lot? Because you don't want to be caught in a bad situation, even though obviously you can save some money. So hopefully this information was helpful for you guys. So we just wanted to kind of clear the air because some patients were getting frustrated because they weren't getting a solid answer. But unfortunately, this is one of these things in life. Like it's like we have a Lexus dealership close to our office. I have no idea, but I think Lexus is probably from like 30,000 to 120,000. They it depends.
Yeah. Even on the phone when people call for like consults, they're like, just give me a ball price, and I'm like, it's hard to say. Like, I've never seen your x-ray. I don't know how many implants you're wanting. I also don't know if you're wearing your denture. You want to do a new denture.
That 3D scan tells us a lot.
Yeah.
It really does. And that like, again, we're not trying to like bait and switch people. We're not trying to be evasive. We're not trying to like draw everybody into this practice as if we have some magical power to hypnotize you to get it to do. No, we need that 3D x-ray. It just tells us so much about and then talking to you about like what type of finish you want on your prosthesis, all these things. So that's the reason why. So hopefully this information was helpful. If it was, please give us a thumbs up and a follow on our channel. Thank you.